the maternal mortality ratio, that's the number of deaths. And generally, as you know, maternal deaths are seen as, for the most part, preventable deaths. So the higher number you have, the more it says about the quality of health care in your country, because they're pretty much preventable. So we have countries like Sweden and Belarus that have 1 or 4 per 100,000. United States white women, 11.7 per 100,000. And United States black women, 42.5 per 100,000, 4 times what white women in the United States have. And as you can see, worse than Libya, China, the Bahamas. Next slide. Neonatal mortality. Again, and all I want to do in this part is establish the idea that black people are sicker than white people, and it's significant. So, so this is the number of deaths of babies during the neonatal period, and again, you can see some countries like San Marino, 0.7 per 1,000 live birth. They don't even have 1 per 1,000 live birth. Cuba, 2.4. Whites, 3.3. Blacks in the United States, 7.5, twice as many as whites. And then Ohio, again, a poor city, 3 times the white rate. Next slide. One more time, infant mortality. The number of infants that died per 1,000 live births. White Americans, almost 5 times Monaco, more than Cuba. Black Americans, twice as large as white Americans, and higher than Botswana and Barbados. And I think this is important to remember, because we often want to make it about being poor. We want to say that there's more poor black people than poor white people, so that explains it. But then why is this? Well, clearly countries that are poorer than us have fewer infant mortalities than black Americans. And Cuba, which is poorer than the United States, have fewer infant mortality than white Americans. Next slide. So that establishes the idea that that black Americans are sicker than white Americans in this country, and that based on the CIA definition related to quality of life, that that white people in this country don't have a good quality of life compared to the amount of money this country have, and black people have it even worse. And part of the problem we have is we've moved into an era where we don't want to recognize racism. And I like this slide because when you say that you're colorblind, you're basically saying you're missing out. You're not seeing the difference, and that makes you do some things that you may not want to do because you don't recognize the differences that are actually occurring. Next slide. So for me to get into a discussion of race and racism and how it impacts health and what I think the problem is I need to make sure we're on the same page in terms of what race is. Race is a social construction, and everybody knows that. And people often want to say, well, since it's a social construction, it really doesn't have meaning. And I'm like, well, no. That's not how it works. Saying something is a social construction only tells you how it was built. It doesn't tell you the impact and meaning that it has. Like, for instance, we only have one world. And so saying that you only have one world doesn't take away from the geopolitical influence of the United States of America. The United States is a social construction, a social political construction that only exists because we made it exist. Now, having said that, doesn't minimize the power and impact that it has and what it might take to get rid of it. United States may not exist in 1,000 years, but right now, today, it does. And right now, today, it has an impact. Race may not exist in 1,000 years, but right now, today, it does. And right now, today, it has an impact. So how do we distinguish then when race has an impact versus something else like class? Because there is a class issue. Being poor in this country is definitely worse than being rich. And that when you are poor, that poverty in fact impacts your health. In fact, being middle class impacts your health relative to being wealthy. So when you want to know whether race is an issue, you have to control for class by comparing people of the same class but different race. And oftentimes, people do what I call a class analysis because they want to say, well, Professor Randall, you're an upper-class Black woman. You are certainly doing better than a poor Black woman. I'm like, yes, you're absolutely right. But that's not a race analysis. That's a class analysis. All you said is middle-class people do better than poor people when you make that comparison. If you want to know whether race is an issue, you have to compare people of the same class. How am I, middle-class, upper-middle-class Black woman, doing compared to upper-middle-class white woman? How is poor Black women doing compared to poor white women? One of the problems I have with all the studies, for instance, one of the big things people want to say is, well, you know, Black people like to eat all of that fatty stuff, so that's how their health is like that. I say, you know what, I do not think, until the study shows me, I don't think poor Black people eat different from poor white people. Now, yes, there are a greater percentage of Black people are poor, but if you want to know how class impacts, you do a comparison of poor Blacks to middle-class Black. But a race analysis, you have to look at whether poor Blacks, how they are doing compared to to poor white. Next slide. Well, we have some studies, as you can imagine, that help us decipher that out. What we see when you compare low-income whites to low-income Blacks, one study found that low-income whites lived 3 years longer than low-income Blacks. 3 years. And that middle-income whites lived 10 years longer than middle-income Blacks. Now, the middle-income Blacks lived longer than low-income Blacks. Remember, that's a class analysis. But we're not looking at class now. We're wanting to know how race impacts things. And this study said low-income Blacks, low-income whites live longer than low-income Blacks. Middle-income whites live longer than middle-income Blacks. Next slide. I brought this slide up because I wanted to show you low birth weight, because I'm going to show you another slide right after that goes into this. And low birth weight babies is a measure of potential problems in a community, because there's so many problems that can be traced to the babies being low birth weight. And as you can see, white women are not doing well. I mean, white women are ranked 40th in terms of the percentage of low birth weight babies. But look at the Black women. Black women have more low birth weight babies than Rwanda, Kenya, Ghana, Uganda, Botswana, all African countries. There is something going on that's more than how we eat, how we exercise. Next slide. So this was a study that looked at low birth weight by class, and if you use education attainment as a substitute for class. And let's just look at the yes component. So what you see is that whites who have more than 16 years of education have a lower percentage of low birth weight babies than whites who have less than 12 years of education. See that? 3.7 compared to 6.7. And the same holds true for blacks. Blacks who have greater than 16 years of education have fewer low birth weight babies than than blacks who have less than 12 years of education. Once again, class analysis. To do a race analysis, we'd have to go across. So what we see is that whites who have greater than 16 years of education have fewer low birth weight babies than blacks who have greater than 16 years of education. So race makes a difference. But the startling thing in this slide, has anybody picked up on it? Is that whites with less than 12 years of education, low-income whites, have fewer low birth weight babies than blacks with greater than 16 years of education. That is that being middle class isn't helping Black people to have fewer low birth weight babies than poor whites, if you use education as a proxy. So something is going on, and it's more than access to food, it's more than access to exercise and all of the things that we traditionally say. Because until you show me otherwise, I believe that middle-class blacks eat like middle-class whites, and yet they have more low birth weight babies than poor whites. Next slide. I just throw this slide in just because I want to acknowledge intersectionality issues, because I keep talking about race and class. I want to acknowledge that when you have disabilities, colonialism, classism, heterosexism, sexism, all of these intersects, and that a person who has more of these things is going to have greater problems in being able to decipher it out. And that you can't you have to look at how does homophobia affect a transgendered woman in terms of her health care. But I'm not going to get into that. I just want to raise intersectionality as an issue that you have to deal with and think about. Next slide. So what do I think is, so I established that blacks are sicker than whites. I hope that I establish that it's not class, it's race. And so what is it then that I think is causing the difference? And I think it's the stress. I think it's the stress due to slavery, segregation, and racism. I think that when you look at middle-income blacks and compare them to middle-income whites, the only real difference in their life is the stress of racism. the stress of living, you know, people get different jobs, people move, people have terrible bosses. The stress of living is about the same, except there is a stress of being Black in a white institution. I can tell you that I didn't realize the stress that I carried around in my body until I retired. And it took almost 6 to 7 months for it to leave and for me to realize. Every now and then I check myself because I'm so used to carrying around this knot in my body that I just thought was normal. And now that I'm retired, the knot is gone. And I think it's the stress of racism. Next slide. And we know how chronic stress affects the body. This is what you've been studying as nurses. Chronic stress, whether it's the stress of racism or being in an abusive situation, going to war, any kind of chronic stress affects the body and causes illness. And all of the illnesses that we see higher in Black Americans. Next slide. So one of the things that I want to look at is the intergenerational transference or the impact of chronic stress, epigenetic inheritance. I believe that we have had, that the impact of slavery has been passed down through our genes. Next slide. Okay, play. This is a film. Could you play it, please?
Yep. So the people that are online are not going to be able to hear the video, but Wilvina's going to be posting the link in order to do so. I get the video play.
Will they be able to play the video at home?
Yes.
Oh, okay. Thank you.
Turns out if your mom was really stressed, congratulations, now you're stressed too. Back in 19... Turns out if your mom was really stressed, congratulations, now you're stressed too. Back in 1998, an ice storm hit North America. If you live anywhere near the Canadian border, you probably remember it. I do. It was crazy. Everything was covered in ice from Michigan to Maine and Ontario to Nova Scotia. The weight of all that ice caused massive damage to infrastructure in both countries, and power outages dragged on for weeks afterward. Not to be caught out in the rain, so to speak, researchers at McGill in Canada found pregnant mothers who were without power and followed them and their offspring for 13 years to see how it affected them. Turns out, the North American ice storm of 1998 affected the kids' DNA. It used to be thought that if I was physically stressed in my body, it wouldn't affect my kids at all. If I was in a famine, then my kids wouldn't be affected by that. And then it turns out that's not true at all. In the 1990s, the field of epigenetics came onto the scene, and we discovered what happens to our parents will affect us, and what happens to us affects our kids, and so on down the line forever. This study, published in PLOS One, found that the children of those mothers had, quote, distinctive patterns in their DNA methylation. DNA methylation is the on-off switch for how the DNA gives its instructions, whether to produce a bone or a red blood cell, for example, would have a different methylation. Alterations of that process change how the same DNA can be read by your body. In this case, a correlation appeared to exist between the length of time without power and subjective suffering of these mothers and the methylation of their children's DNA. 36 of the children tested showed the same pattern of methylation on their T cells, and that was the most stressed mothers. These cells are part of the immune system, so chances are the kids are going to have some kind of a different immune system response than their parents do. If you're wondering what that will mean, you're right there with the other scientists. Nobody knows yet. It's not like they can compare kids pre and post DNA methylation. They were born that way. But this is the first time ever in humans that science has been able to show that a single maternal stressor was able to affect the DNA of the offspring. Now that we know this happens in humans, we can go back into history and see what we can learn from these epigenetic changes.
Okay, so my theory is that the reason we have a significant health disparities is that we have these epigenetic changes that slavery, segregation, and racism has caused, and that that impact has impacted how our genes work. So this slide, this is a schema that I developed. So slavery, legal apartheid, which a lot of people call Jim Crow. I don't like the term Jim Crow because I don't think many people know what it means. I grew up doing legal apartheid. I was I was a young adult when the Civil Rights Act of 1964 was passed, and so that meant I grew up in the South, and I grew up during legal apartheid. Racism has existed from the beginning of slavery up until today. And I believe that we have a new form of slavery. I call it neo-slavery, and that my grandkids are being raised up in. These systems of slavery and racism have resulted in deprivation and oppression, which resulted in embedded social racial inequalities in the communities. And so you see difference in wealth, education, in that whole list, in every area. And then people say, well, don't people have a responsibility for choices they make? You know, if they are eating at Rally's burger, you know, aren't they responsible? Well, of course, yes. That's a responsibility. But you've got to put it in the context of the communities they live in. I live in a food desert. We have Dayton, a town of 150,000, has 2 grocery stores inside the city limits. But you can get McDonald's and Rally's and all of the fast food you want within a mile of anybody. So here you've got you have a tired working class woman or man coming home, and there's no store for them to stop and get anything except, let's not even get started about Dollar General. We can talk about that in the question and answers, because Dollar Generals are becoming the replacement stores for grocery stores. So there's no place to get any food, but you can get a hamburger for $1, French fries or whatever, and so you stop and get it. And so to some extent, people make choices they can make given the environments they live in. But having said that, it still doesn't, in all of this, their choices impact the choices they can make, and that impacts their health, mental and physical, their biochemistry, and their genetics. Not in terms of genes being different, not in terms of saying genetically we are different species, but in saying that that stress and stuff impacts how your genes operate. They've done studies on Holocaust children of Holocaust survivors. They're doing studies on children of Vietnam era veterans, and in both of those groups, they are finding that the children and grandchildren people have genes that operate differently. Next slide. So what do we do about this? Okay, so I've established, I hope that I established, we're sicker, that it's race and racism, and that just telling people to eat right isn't going to be sufficient. How do we eliminate maternal health disparities of descendants of Africans enslaved in the United States? That's what DAIS stands for. Next slide. Well, first of all, we have to provide equitable reparations. This country has never provided reparations. And don't even get me started on affirmative action is not reparation. Because reparations would repair the harm that was done to the whole group. It wouldn't give special admissions to a few. It would say that for 400 years, 300, 200, we kept the Africans and their descendants from being able to develop wealth. For another 100 years, we had laws that kept them from developing wealth. And it's only been since 1964 that we even began to dismantle legal slavery, legal apartheid. And at no point during this time did anyone say, let's study the impact that slavery has had on Black people, and let's make a plan to undo that impact. And that's what I mean by equitable reparations. And that's going to mean doing something about education, doing something about healthcare, about getting wealth into not only the community, but into families and individuals. It will be a massive, expensive undertaking. But if we want to undo the impact of slavery, we've got to do that. We can't, you can't tie someone's leg, not let them in the race, tie their legs, and then say, hey, well, it would be unfair to the other runner if we did anything to help you. No, we've got to do reparations. Next slide. This is just a slide that just kind of shows you how little time we have actually been out of some kind of system of oppression. If you look at the affirmative action era, it was only 16 years, 1964 to 1979. Since 1980, we have been steadily moving into another racial entrenchment area. People like to look at Trump and everything that people are doing now. No, honey, that's been going on since 1980. It's just that Trump and his era has just given permission to be verbal, to be more vocal about what's going on. But Clinton and the mass incarceration through Democrat Republican presidents since 1980, we have had racial reentrenchment and neo-slavery. Next slide. So, one of the things that you can do, you as an individual can do, is help reduce racial stress for Black people in your environment. Okay. And one of the sources of racial stress is microaggressions. Microaggressions occur every day, all day. They occur when you are in a work environment. They occur when you watch TV. You sitting up watching TV, just wanting to have fun, and then you get slapped in the face by some stereotypes, something that is happening in the movie that turns your stomach and is an aggression, a macro or microaggression. And so to reduce the racial stress, we're going to have to eliminate racial micro affronts. Okay, and I like to use the word affront because aggression implies a certain kind of intent. And I don't think people intend this. And in fact, I think there may be of goodwill, but they don't understand the nature of what they're doing and the impact it has on individuals. This is a film. Could you run it, please? It's not a, is it playing?
Think that microaggressions are a problem?
Let me just get the volume up. Hang on 1 second. I'll make it big. All right.
For people who still don't think that microaggressions are a problem,
Oh, you're so well spoken.
just imagine, instead of being a stupid comment, a microaggression is a mosquito bite.
Ugh, it's a compliment.
Mosquito bites and their itch are one of nature's most annoying features. But if you're only bitten every once in a while,
No, where are you really from?
Cleveland.
sure, it's annoying, but it's not that big a deal. The problem is that some people get bitten by mosquitoes a lot more than other people. I mean, a lot more. Whether it's on a date,
Oh, your English is so good.
Excuse me?
going grocery shopping,
You know, everything happens for a reason. Just put it down.
commuting to work,
It's the weekend.
watching TV,
We have to do things. Work for culture and history.
or just walking down the street with your partner.
I couldn't even tell you were gay.
Mosquitoes seem to pop up
You
everywhere.
know, John, can you shopping advice? I was here too.
And getting bit by mosquitoes every goddamn day,
Touch your hair.
multiple times a day, is fucking annoying. It just seems like a huge overreaction to people who only get bit every once in a while.
It's just a mosquito bite. Who cares? Just another angry black one.
Of course, some mosquitoes carry truly threatening diseases that can mess up your life for years.
Astrophysics? Maybe you should try this challenging major.
And other mosquitoes carry strains that can even kill you.
You look like you was up to trouble, okay? I felt threatened.
So next time you think someone's overreacting, just remember, some people experience mosquito bites all the time.
You're all so exotic. Wow.
And mosquitoes need
So the microaggression thing, and that's just to introduce. I'm sure you know, have been looking at this, and in the few, you need to start learning what kind of microaggressions happen, and you need to figure out a way to stop it yourself, but probably more important, stop others. Because when people engage in it, the burden shouldn't be on the person who's suffering the mosquito bite to say, oh my God, you just bit me with a microaggression. Anyone standing around can take responsibility for that, and that will help reduce racial stress. I'll move forward to the next slide, and I'm going to come back to this. We have to change systems, institutions, and colors, and we can start with healthcare. We have racial barriers to access. We have economic barriers. We have lack of providers in community. For all of the praise that the Affordable Care Act and Obamacare did, it only provided an ability to pay. It didn't actually provide providers and facilities in the community. So to the extent that communities didn't have providers, and this was also true for rural communities, not just Black communities, well, it's true for a lot of communities, the lack of providers in the community, you don't have a provider, the ability to pay doesn't provide you access. In addition, the ability to pay doesn't address quality issue. It doesn't address discrimination in treatment, or the lack of cultural competency, or language barriers, or cultural barriers in how things are organized. Healthcare has traditionally been organized to serve the needs of middle-class people. People who have jobs, even upper middle class, I would say, people who have jobs that will allow them to take off, allow them to go into a doctor without losing any pay. And if you want if you want to serve a community, you've got to have to figure out what the community needs are and then structure a healthcare delivery system around communities. A one-size-fits-all system is going to result in disparities in healthcare. Can we go back to the next slide?
The previous slide?
The previous slide, yes. And that's one to play. Could you play it?
Sure.
Moving the race conversation forward. You've probably noticed that when our news media talks about race, when they talk about racism, when they talk about racial justice issues, they quite often talk about it all wrong. And systematically breaking down the most common mistakes we fall into when we talk about race. And in their research, Race Forward identified 7 harmful practices, the 7 most common bad habits in media coverage of race, as well as recommended strategies to get us back on track. And I recommend reading all 7 for yourself, but right now I want to focus on just one of the biggest traps that racial justice conversations fall into, which is our tendency to focus too much on individuals instead of systems. Because when we talk about race, when we talk about racism, when we talk about racial justice, it's important to remember there are levels to this thing. There are at least 4 different levels of racism that each need to be considered. The first level is internalized racism, which is all the prejudice, bias, and blind spots you might have within yourself as an individual. The next level after that is interpersonal racism, which is what happens when we act out that internalized racism on each other. Those 2 levels, the internalized and the interpersonal, are the 2 individual levels of racism. And those are the simplest ones to focus on, the easiest to recognize in our day-to-day lives, the ones we spend most of our time talking about, but I'm here to tell you, there's something else, systemic racism. Once you get past those individual levels, first of all, you have to deal with institutional racism, the racist policies and discriminatory practices in schools and workplaces and government agencies that routinely produce unjust outcomes for people of color. And when you step beyond that level, you have structural racism, the unjust racist patterns and practices that play out across the institutions that make up our society. The individual and systemic levels of racism are both important, both necessary to reckon with, and they're both usually interrelated. But if you want a real, fully clear-sighted conversation on racial justice, you have to be talking about both levels. And one of the most common ways we fail to see the big picture on race is by failing to think about systemic racism, by failing to be systemically aware. And then,
Okay, next slide. So one of the things I want to talk about is the law, because I'm a lawyer now. And one of the problems we have is that one of the things people always say is, oh, you can't discriminate based on race. And I'm like, oh, yes, you can. In fact, you can discriminate a lot based on race. Because American law does not outlaw all forms of racial discrimination. It only outlaws one type of racial discrimination, intentional. So you can be reckless meaning that you didn't intend to do something, but there was a high risk that you would discriminate. You knew of the high risk and you did it anyway. You can be negligent meaning that you didn't, there's not a high risk, but there is some risk. And this is the kind of thing that the average, the reasonable person would not do it because it would discriminate. But you did it. You did the conduct, you acted unreasonably, you discriminated. You can discriminate negligently. And then there's strict liability. Strict liability is when you do something, you cause discrimination. There wasn't a high risk. You weren't reckless, but you did discriminate. There are strict liability crimes. There are strict liability torts. And I've always wondered why criminal law, I taught criminal law and tort law in addition to anti-discrimination law. And I have never completely understood why in other areas of the law we recognize that people can act recklessly and negligently, and that we even say there's some behavior that we don't care whether or not you acted recklessly or negligently. If you engage in the behavior, you're going to be responsible. Why don't we do that in terms of discrimination? And because we don't do it, because we have tons of discrimination in this country based on race. Pretty decent about getting rid of intentional discrimination, but reckless and negligent discrimination, people engage in it all the time. And people will argue with you that it's not discrimination because it's not intentional. That's how far along we have come, that people don't even think of reckless discrimination and negligent discrimination as discrimination. They only think of it as intentional discrimination. We need to change the law. The law needs to recognize reckless and negligent discrimination, because I think that you would find people, it would do what we expect the law to do. Get people to change their behavior because they don't want to break the law. They don't want to be held liable. And so they would stop being reckless and negligently discriminating. Next slide. I'm not going to spend too much time on this because but I want to just show you that it's important to distinguish stereotypes, bias, and prejudices from micro-affronts, discrimination, and other behavior. So you can have stereotypes, biases, and prejudices, but not discriminate, not engage in micro-affronts, not engage in other unacceptable behavior. It's my belief that everybody has stereotypes, biases, and prejudices, but that people can actively, and institutions can actively decide not to discriminate. And when I say not discriminate, I mean not to recklessly discriminate, not to negligently discriminate. That means that institutions and institutions that you work in have to decide, even though the law doesn't require us, we are going to make that our level of standard. We are going to say in our organization, we don't engage in reckless discrimination or negligent discrimination. Next slide. So, sort of the last thing I want to talk about is eliminating neo-slavery. Now, I know that there's people who are going to balk at the idea of calling it slavery. There's people like, oh, slavery, this isn't slavery. This is something different. Yeah, the difference is neo-slavery. The neo part, that's the difference. Think about it for a second. So first of all, people say, well, not everybody's enslaved in America. I'm like, well, not every black person during slavery was enslaved. There were people in the North who weren't enslaved. There were free blacks. There's always been free blacks. Slavery, and so the fact that there are free blacks doesn't mean that you don't have slavery. But free blacks suffered widespread legal discrimination during slavery, and they suffered widespread legal discrimination now. So while there may be a greater percentage of black people who are free, the idea is that, yes, but those black people who are free still suffer widespread legal discrimination. So then the other thing is, well, okay, but there's no slavery in America, no slaves in America. Well, yes, there are. The 13th Amendment basically says anybody in prison can be enslaved. And in fact, if you look at how prison is, and that's a whole nother lecture that I don't have time to do, and you don't have time to hear, but the prison industrial complex is not just about locking people up, it's about using those people's labor for the benefit of corporations. There's widespread use of prison labor. In addition, there's the whole idea, what is the difference between having someone enslaved on a farm and using them to generate wealth by being a laborer, and having someone enslaved in a prison and using that imprisonment to benefit wealth and to bring about wealth through the imprisonment. A significant portion of the population is subject to forced labor and slavery under the 13th Amendment. So that aspect. So the third aspect of slavery was terrorism through lynching. And I submit to you that neo-lynching by cops, by stand your ground laws, is every bit as terrorizing and maybe more than the lynching that was done by the KKK. I fear for my grandsons who are being raised in Florida. I fear that some white person is going to look at a big black kid coming towards them and shoot them. Cops are going to shoot more quickly because the person is black. And if my son doesn't use the right tone of voice, or doesn't act exactly like the person think they ought to act, they could be dead. That is neo-lynching, and that's terrorism, and that's the same as the lynching that occurred by the KKK. Is now just being conducted by cops and by stand your ground laws. Next slide. So I want to come back to this and sort of end on this and go to a question and answer, go to a discussion period from this. There has to be a recognition. This goes back to what I said at the very beginning. You have to look at people's histories, because people have different histories as to how they got here, how their people as a group got here, and what happened to them. For descendants of Africans enslaved in the United States, we have never been out from under racial stress, at a minimum. And mostly, we've been in some form of oppression and subjugation. And until we address that, we won't be able to get rid of health disparities. What does that mean for you as a nurse? Well, it means that you practice good nursing, obviously, and that you engage with people in terms of counseling people appropriately and giving people the best nursing care. But it also means that in your role as an advocate, that you have to advocate that for people doing something different. That is not enough to advocate for good health care. You're going to have to advocate for eliminating the racial health disparities by eliminating the impact of slavery, segregation, and racism. I think that's the last slide. Yeah. Thank you.
Thank you, Dr. Randall. We have about a good 20 minutes for some comments and questions. So
could people, while people get their questions together, I'll be right back, okay?
Sure.
Okay.
As people ask the question that they have,
sure,
that it's loud enough as we go through. I know we had trouble last time with that. Not all of us are loud. Can you buy? Oh, I'm sure. I think they're. I will.
Okay, I'm back.
Okay. All right. So we're going to do about 15 to 20 minutes of question and answer. So. Go.
Okay, so Dr. Randall, my question is about your definitions for the different types of discrimination, the different levels of discrimination. I was just wondering, I'm seeking a little bit of clarity on the difference between reckless and negligent. I was just wondering if you can give examples of like what would be negligent racism, like a I don't know, like a case study or an example. What's negligent?
Sure. Let's say you work for an institution that finds out that a policy they have adopted discriminates against, ends up in having Black people have less access to health care than their white patients. Okay? So under the law, I would have to show that you intentionally did that policy that way. That somebody sat down and said, you know what, we don't really want Black people coming to our institution, so let's kind of make this policy that will keep them out. The policy can be neutral on its face. It doesn't. You don't need the policy to say, let's keep out Black people, but you need people to have had that as their intent, their desire, their actual desire. That's actually a term of art in the law, actual desire. Recklessness is where you're sitting about making a policy and someone says, you know, if we adopt this policy, Black people are going to be discriminated against. They're going to have the same access as white people. And you say, oh, I know that, but, you know, we need to do it because it'll cost us less money if we do it this way. Well, there's no intent there, but you knew it. You knew there was a high risk of it, and you did it anyway. That would be reckless. Negligent would be, you just adopt a policy. You don't discuss the impact that it's going to have on other people, so you may not even be aware that it's going to have the impact at the time you adopt the policy, but you should have known it. You should, in fact, that's the standards called should have known. When you should have known something, that is, you shouldn't adopt a policy that's going to discriminate against Blacks if Blacks is a part of your population. You should have known that the policy was going to discriminate. Since you didn't know, since you did it, you didn't do it intentionally. You didn't do it recklessly because you didn't even know the risk. But you were negligent because you should have known and you didn't discuss it and you didn't try to minimize the discrimination by finding alternative ways of doing it that would minimize it. Does that help explain it?
Yes, but so just to follow up just really quickly, do corporations or would anyone, is it against the law to keep those in place even after you realize what the implications are of any?
Oh yes, it's not against the law to keep them. That's my point. Currently the law is you can know that it's going to discriminate as long as you don't intend to discriminate. You can know it. Yeah, you can keep them in place even after you know it because that wasn't your intent. And that's the problem. That's how come we have so much, they call them disparities. I'd like to call it discrimination. People talk, we have this disparity here and we have this disparity here. Well, what they're really talking about is some institution adopted a policy that caused the disparity and it's legal. And I'm saying that we need to make that illegal.
Thank you.
Hi, Professor Randall. I have a couple of questions. One to get my opinion about it. While working in the emergency room, I used to witness providers not giving African Americans pain medicine, like the standard protocols for giving morphine when they come in for chest pain, and making them wait longer than 10 minutes at a time, because the assumption that I don't know if you've found this to be true, that the assumption is that because we're out in the fields for long periods of time that we can endure pain.
Yeah.
And even in labor and delivery, I've seen that too, like patients asking for pain medicine and patients who look like me and they're having them wait longer to give them pain medicine. So is that?
Yeah, that's where the discrimination. Go ahead. I'm sorry. Did I interrupt you?
No. I was just wondering along the lines whether that's law in terms of negligence or recklessness or.
That would be. It could be reckless if they know that is wrong, but they do it anyway. They know there's a risk, but it's probably more like negligent, where they should know better. If they don't, that's the sort of thing like, you may not know better, but you should know better. And consequently, if you are if you are treating black people differently because you have a different idea about what they can do, you have discriminated because you should have known better. The fact that you didn't know better don't save you. I'll give you an example that's in the context of a store because it makes it real clear. Okay. Water on the floor. Maybe the manager doesn't know someone slip and fall. Don't make no difference. They should have known. They should have had people running around, inspecting the store, and putting up signs. And so the same thing I would say. Now, there's an argument because what you describe, I don't think of as implicit bias. I think it is explicit bias. Explicit. They have a bias. It's really clear. They don't think black people have pain. Implicit bias is where people don't even know they have the bias. But when you study their records, there's clearly something going on. And you often you can often see that, especially in people, I put goodwill in quotes. People of goodwill don't think that they can be racist and don't think that they have biases that will impact their behavior. And so they go merrily along, not looking at how they do things and then treating people differently. But yeah, I think what you described is explicit bias. Wrong, and they should know it's wrong. And that's why it's at a minimum negligent. Now, I just read an article that argued that, in fact, I just read this, because I had been saying up to this point that I hadn't found an area where I would have strict liability. Well, strict liability is where this discrimination occurs and they're responsible, period. Doesn't matter whether they should have known. It doesn't matter whether they're reckless. This person argues that because implicit bias is so hard to get at, that discrimination, a lot of discrimination should just be strict liability. If there's a disparity, unless you can show a rational reason, you're going to be responsible. It doesn't matter whether you knew or should have known or of the risk. Did that answer your question?
Yes, Devin, thank you. And how
You're welcome.
When people from other groups compare your experience and refer to it as the Black experience and say things like, to justify their experience, but they may have experience in terms of barriers and obstacles, and compare it to the Black experience, and you may find it. I
didn't understand the question. I'm sorry.
How do you address issues when we're talking about other people's experience, like gender identity or just different barriers that another person in another ethnicity may say, well, you know, I'm from the Jewish community, and they're talking about in reference to the Holocaust, and they say, well, and compare it to the Black experience. How do you? And sometimes it's said, sometimes people can say and not realizing that they're like minimizing what you and your culture have experienced. How do you address those issues? How do you handle it? How do you address it?
Okay, I guess I'm part of it keeps fading out, and I how do I handle?
When someone's
say it again.
They talk about their culture, that they've experienced some kind of tragedy, but they're comparing it in terms of saying, well, the Black experience it's very similar to my experience. How do you like slave in terms of slavery, or but they're their experience and minimizing.
I actually just say to them, how do you know that? You've been Black? I mean, you know, because I would never presume to say that being Black is equivalent to being transgendered. I don't know what it means to be transgendered. And I would never presume to say it's better or worse. It just is. And I think that what I would say to people who say to me that in any kind of setting, that to say that presumes that you have a complete understanding what it means to be Black.
Thank you, Dr. Randall.
You're welcome.
Hi, Dr. Randall. I actually live about 5 minutes north of Dayton, so I'm thrilled to see you even though it's virtual. I'm curious to know what your opinion is about the disparity of outcomes when you were looking at the statistics early in the discussion about maternal child health outcomes. Why is there such a big difference in some of those statistics for Blacks and then Blacks in Dayton? Is there something specific in our city that you've been able to pinpoint? Or, I mean, aside from the fact that it is a giant food desert, and I think there's a lack of providers, is there anything else specific that you've seen that we can change?
Well, I think that it fits right in with my whole model, because I believe that Dayton is under huge stress. It's a dying city. The middle class people who can afford to are moving out, are moving their kids out of the schools. So even though only 45% of Dayton is Black, the school is like 85% Black, and 90% poor. I think people underestimate the stress of living in an area like this, even if you're middle class. That just the stress of being in a dying city, the stress of trying to figure out how you're going to feed, the stress of a bus system that doesn't work. That if you want to ride, you got to ride the bus. They spent years, and you're from there, you know, they spent years trying to keep the bus from stopping in front of the mall because they didn't want the poor Blacks and poor whites getting off in front of the mall. You don't live in this kind of environment without being under stress. People might go along every day as if everything is fine, but they're not. They're stressed out. They're stressed out every single day, every single minute, as they try to struggle through what it means to be in this kind of poor area. And being middle class doesn't help if you live in the city. I live in the city. So I made a choice to live here, but I made a choice to have to have a constant amount of anger. So I go to the Dollar General because it's post, okay. And I go to the Dollar General, and every time I go into Dollar General, I get mad and say I'm not going to go to Dollar General in my neighborhood anymore because they don't keep it clean. And I'm like, but I know that Dollar General keeps their stores clean because I go to other ones. So why is this Dollar General not clean? Because they don't think we deserve it. You know, and so, but you have the stress. People who don't have the car, don't have the money, don't have the resources, they have to go in there, and they know that they're being treated differently. They know that the stuff up all over the floor, the dirt on the floor, they know that's not right, and that's a stress. And that stress affects their health and affects their baby outcomes.
One of the slides that you didn't have is the preterm birth rate in Dayton, which is twice as high as anywhere else in the country and 3 times higher for African American women in Dayton. And I did my preceptorship with the midwives at the SAM. And one of the things that I found really interesting is they didn't talk to the women there about their risks and about their health disparities and the things that they were at risk for. So my question for you is, how on a provider level do we address this with the African American women that we take care of?
Well, I think first of all, I think it has to start before people get pregnant. That's certainly true. And I think you have to be honest with people in terms, and you have to make it a part of, this isn't your responsibility. You are not at fault here. You inherit a system that impacted you, and all you can do now is do the best you can to try to change the impact of previous systems. A lot of time people go into counseling people in terms of, you're not going to eat right, you're not going to exercise right, you're not going to do all these things because whatever. But instead, I think you should go, we know you're going to eat right, and what we want to do, and we know that you live in a situation that makes it difficult for you to do that. So let's figure out how you can get it done, because we know that's what you want to do. And I'm here to help you figure it out. Help you, can you go into a co-op together? But, what kind of ways can we get fresh fruit and vegetables into your life? Because one of the things, and you can even start telling them things, studies show that poor Black women actually eat more fruits and vegetables when they're available than poor whites. At least some studies. I have to be careful because, these studies are never quite accurate.
Well, Dr. Randall, on behalf of Frontier Nursing University and Diversity Impact, we want to thank you so much for your time. Thank you for your contact information. I encourage all the students and the attendees to message you with any additional questions.
Yes, I'd be happy to talk with you more.
Thank you.